Hi everyone, thanks for stopping by. My name is Sandy. I'm a registered nurse at Windsor Regional Hospital Olette Campus, and today we're going to talk about TIAs and strokes. We're going to start off with watching this commercial that Heart and Stroke has put out, and then we're going to discuss it.
Now he's been wanting to put garlic chives in everything.
Well, not everything.
Dad, the side of your face is drooping. Mom,
It's probably nothing.
Dad, are you okay?
You're slurring. Why are you slurring? Raise your arms up in the air for me.
Dad, are you okay?
Gracie, call 911.
I said,
Honey?
Oh, Dad!
Tim!
I need an ambulance to 7th floor
Tim!
Avenue.
Tim, look at
I
me,
don't know what
Gracie.
the
Tell them to hurry.
Tim,
Look at me. Look at me, Tim.
Mom, what do I
I don't know. I think he's having a stroke.
I think my dad is having a stroke.
Tim, what's going
Dad?
on, baby? My husband. He. I think he's cold. Are you cold, honey? Are you cold? Okay. Gracie. See, Gracie's gonna come, sweetheart. We're just gonna go. We're just gonna go in the ambulance right now. We're gonna go to the hospital. Okay? Okay. Huh? I'm right here. I'm right here. Gracie, meet us there. I'm right here. I'm right here. Okay. Okay, here we go. You just stay right here. You just stay and breathe. Just breathe. Tim?
Dad?
How you feeling?
I'm fine.
Well, you've had a stroke, but because you got here quickly, you're looking at a full recovery.
So, we need to remember the word fast. F is for face. Even if you're home by yourself, you can go to the mirror and smile. It'll be very obvious if one side of your face is drooping. Arms. Can you raise both of them evenly, as if you're going to dive off the diving board? You will notice if one side is weaker than the other. Speech. Is it jumbled? Is it slurred? Is it confused? Any kind of abnormality, you need to call 911. So we're going to talk about the different types of strokes, what causes a TIA, how the brain works, risk factors, some of the tests that you may have had done, what we're looking for, why we're looking for it, and we're going to talk about different signs and symptoms. So let's start off with the different areas of the brain. Depending on where you had your stroke or your TIA, everybody's symptoms will be very different. People who have strokes in the frontal lobe, they may have difficulty later on with problem solving, reasoning, things like making change at a checkout, or filling out the blanks on a check, filling out any kind of paperwork. They may need some assistance, and it takes time for the brain to heal. In the temporal lobe, this is a very common area for TIAs. People will have speech impairment. Now, the speech impairment can last anywhere from several seconds to several hours. Some examples that I've heard before are, I was out shopping with my daughter, and all of a sudden I knew what I wanted to say, but I couldn't roll it off my tongue. So we call this expressive aphasia. Other times, people will say, it all came out jumbled up. It all came out confused. Sometimes it came out slurred. And this is a type of aphasia that is also very typical of a TIA. In the occipital lobe, this is your visual field. I've often heard patients say, I was driving along and all of a sudden the vision in my right eye went completely black. Some people will describe it as a black circle in the middle of my visual field. Oftentimes, I've also heard patients say, it's like somebody pulled the blind down and I could only see out of the bottom portion of my eye. Other people have described it as, it's like somebody closed the door. I couldn't see to my far left. I could only see straight ahead. In the cerebellum, this area of the brain controls all your balance and coordination. Now, sometimes people will get up from a sitting position and all of a sudden they feel like they're on a ship, or everything's really wavy. Sometimes people even get vertigo with this, where the room will spin. Now, people who experience strokes in the brainstem, this regulates all your bodily functions. Everything from your blood pressure, to how quickly you breathe, to your internal body temperature, to how quick your heart beats. So what does TIA stand for? It stands for transient ischemic attack, meaning very short term. As I said earlier, it could last anywhere from several seconds to several hours. It's definitely a warning sign that the blood flow to that area of the brain is not what it should be. Some literature and some physicians will even refer to a TIA as a mini stroke. There are two different types of strokes. There's an ischemic stroke, which is interruption of blood flow to certain areas of the brain, usually due to a blood clot and sometimes the blockage of plaque. A hemorrhagic stroke, this is due to ruptured blood vessels in the brain. The two of them are treated extremely differently. An ischemic stroke, if there's a blood clot sitting in there, we need to get rid of that blood clot by giving you a wonder drug called TPA. Sometimes, if the clot is really large, we can actually go in and extract the blood clot. A hemorrhagic stroke is treated with large doses of vitamin K and other medications to stop the bleeding in the brain. Now, you've all heard that saying that we're all wired a little differently. The brain is divided into two halves, the left side and the right side. Some people are left side dominant, where others are right side dominant. The left side of your brain typically controls tasks such as reading, writing, talking, and thinking. The right side of your brain is the creative side. This is more noted with musicians, poets, authors, actors, and artists. So what causes a TIA? Well, we've already talked about the temporary lack of blood supply to the brain, and sometimes our vessels can be plugged with either a blood clot or the cholesterol, which turns into plaque. Sometimes if a piece of plaque breaks off, it can travel to the brain and causes sort of like a temporary roadblock. And for that very short time, you will experience those symptoms depending on what part of the brain it affected. If it's due to a blood clot, then we either have to dissolve that blood clot or we have to remove the blood clot. Now, blood clots typically, they originate from the heart. And when they travel from the heart, this is when they cause serious problems. When a blood clot gets wedged in your lower leg, it's a deep vein thrombosis, and your calf becomes red and swollen. When it travels to your lungs, we call that a pulmonary embolism, and people generally get short of breath and they experience cardiac or respiratory symptoms. When it travels to your brain, we have a stroke. And when the blood clot travels to your heart and plugs one of your major arteries, people have a heart attack. And that's when they end up having either angioplasty, open heart surgery, or bypass. This picture here shows a very healthy, normal artery. There's 6 layers to a healthy artery. And as you can see where that purple arrow is, that the blood flow is quite open and free. The lower picture shows an artery that is diseased with atherosclerosis, or in layman's terms, we call this hardening of the arteries. You can see where all that plaque is, that the arrow doesn't have a large opening at all for the blood flow. The heart has to work harder to pump the blood flow through. Also, if you're not on a statin drug or a cholesterol pill to stabilize the cholesterol that's already there, a small piece could break off from the pressure and travel to the brain, causing a TIA. Now let's talk about some of the tests that you may have had done. The first one is a CAT scan. If you happen to come in by ambulance calls Emerge and says, we have a patient coming in, a potential stroke. So they get the next patient off the CAT scan table and make it available for you. Once the CAT scan is done, we want to know two things. Number one, did the patient have a stroke? And if so, what type was it? Was it ischemic or was it hemorrhagic? Because both are treated very differently. The EKG, this is where you had all those sticky pads all over your body, and we're looking for an irregular arrhythmia called atrial fibrillation. If you are diagnosed with atrial fibrillation, they have to be treated with blood thinners. An echo is an ultrasound of your heart. This is where we put the ultrasound gel on your chest and pushed really hard with a white wand. What we're looking for are all four ventricles. We're looking at your valves. We're looking at the major artery coming into the heart and the one leaving. And then we're specifically looking to see if there's a blood clot sitting in one of the chambers. If so, that has to be treated also with a blood thinner. Now, in regards to the carotid ultrasound, we have two ascending carotid arteries, one on each side. They're going to the brain. And then we have two descending carotid arteries, one coming back on each side from the brain. So we have a total of 4 carotid vessels. What we're really looking for here is if there's any blockages. In medical terms, we call that stenosis. This is measured in percentile. Now, best practice guidelines say anything over 50% blockage or stenosis needs to be addressed. Of course, at 50%, we start with medical treatment and we'll put you on an antiplatelet, such as aspirin or Plavix. Now, after the 70% mark, we start considering surgery or a carotid stent. An MRI is a 3D picture of the brain, and there's numerous slides taken, and the computer generates a beautiful picture of your brain to show us specifically where the stroke or whatever else there may be, a lesion, an aneurysm, anything like that. Now we're going to talk about heart monitors. There's 2 different types. There's a Holter monitor and a loop monitor. Depending on what type your physician orders, one can be used for 48 hours, whereas the other one is worn for 4 weeks. Now, sometimes, depending on where you get your heart monitors from, the batteries need to be changed at the 2-week mark, and then you wear it for an additional 4 weeks. Once all the data has been collected on a memory card, sort of like a camera, the office will read the card, it will interpret all the information, and a printed report will be sent to your doctor. And then from there, we're going to treat what needs to be treated. Now, the gentlemen like to wear these sort of on their belt loop or like a pager, and the ladies tend to wear them in a little harness that we give you around their necks. The only time that these cannot be worn is when you're showering, bathing, or swimming. All other times, exercise, activity, running up and down the stairs, running errands, the monitor should be on so that we get a good idea of what's going on. Now, the 2 procedures, we talked about either surgery or a stent. So let's talk about the surgery first. The medical procedure is called a carotid endarterectomy. Now, we are very fortunate in the city that we have vascular surgeons and neurosurgeons who perform this operation. So what they do is they make about a 4-inch incision along the neck. They open up the carotid artery as seen in the second picture, and then we remove the piece of plaque as a whole. Suture up the vessel, suture up the neck tissue, and within 2 to 3 days, you are discharged from hospital. Now, the first 24 hours are usually spent in the intensive care unit for closer monitoring. Your doctor will give you discharge instructions as to driving, heavy lifting, etc. The carotid stenting is done here in diagnostic imaging under one of our radiologists. You are taken to the angio suite. your groin is frozen, you're given some conscious sedation through an intravenous. And what they do is they feed this stent all the way from your groin up to the carotid artery. As you can see in the first picture, all that plaque there is starting to block that vessel. So the stent, the basket gets put in place, the plaque gets gently pushed to the sides, and then the guide wire is removed. Now these stents stay in place for many, many years. As long as you continue to take your cholesterol pills, eat a healthy diet and exercise, this stent should stay wide open. A risk factor increases the chance of developing a stroke. It's very important that once we identify your risk factors, that we try to make as many changes as possible. There are certain things, of course, that we have no control over. For example, age. As we get older, we tend to have more medical problems. It's important that you visit your physician on a regular basis, have your yearly physicals, have your regular lab work done, and get your blood pressure checked. It used to be that men were more prevalent in heart and stroke disease, but now it's women. Certain races, regardless of their diet, their exercise, their lifestyle, are known to have high blood pressure, high cholesterol, and diabetes. Family history. Well, we've all heard that saying, we don't get to pick our families, right? Well, sometimes we don't get to pick our risk factors either. There's oftentimes people who eat a healthy diet. They're very active, they cycle, they swim, they run marathons, and still, unbeknownst to them, until they've had an episode, all of a sudden they find out they have high cholesterol and they have to go on medication to control it. Now, there are many risk factors that we can change, and we're quickly going to go over all of these. Hypertension is the medical term for high blood pressure. Everybody's blood pressure should be below the 140/90 mark. If you're diabetic, we want it below 130/80. These numbers are all put out by Heart and Stroke. It's very important that when you go to your doctor, ask him, what is my blood pressure today? I'd like to know. When you're out and about running errands, stop at the drugstore, stop at the grocery store, check your blood pressure. High blood pressure is often known as the silent killer because people do not have any symptoms whatsoever. Dyslipidemia is the medical term for high cholesterol. Now that you're all watching this video, we want you to be aware of your numbers. HDL is healthy, LDL is lousy, total cholesterol should now be below 4. Your healthy should be greater than 1, and your LDL should be less than 2. Diabetes can often lead to high blood pressure and higher levels of cholesterol as well. It's very important to take your pills or your insulin as ordered by your physician. If you monitor your blood sugar levels, bring your little logbook with you. We can take a look at that logbook quite quickly and get a good idea of what your blood sugar is doing, whether it's up and down or whether it's more steady eddy. So atrial fibrillation, we spoke about that a little bit earlier. It's a condition which is involving an irregular heart rhythm. So people who have atrial fib are 3 to 5 times greater of having a stroke than those without atrial fib. Some people might flip in and out of this rhythm. We call that paroxysmal atrial fib. People who are in the rhythm at all times, it will show up on an EKG and it'll show up on certain tests that we do. That's why we want you to wear those heart monitors so that we can monitor whether or not you're going in and out of this rhythm. So starting an exercise program can be quite simple. We recommend at least 2.5 to 3 hours a week. So something as simple as walking. It doesn't cost a lot of money. It can be enjoyable. You can do it with a friend or do it by yourself. Whether you choose to walk 1 hour on Monday, Wednesday, Friday, or you choose to do 30 minutes a day. Mall walking is very popular since the mall opens at 7:30 a.m. and then you don't have to deal with the weather, the traffic, or animals. The other place that people like to walk freely is some of the walking tracks at the new arenas. It's indoors. Again, you don't have to worry about traffic, weather, or pets. 50% of Canadians are overweight, and that's due to poor eating habits. It's very important to have 3 well rounded meals a day. Smoking is the most preventable cause of disease and death in Canada. It's very difficult to quit smoking. There's all sorts of new ways that you can quit smoking with nicotine replacement therapy. There's medications that you can take. Talk to your family physician, and they'll be better to advise you. Smokershelpline.ca is a great resource for quitting smoking. They also have a toll-free number on their website. Now, alcohol should be limited to 10 drinks a week for women. Now, that means no more than 2 at a sitting, and men should have no more than 15 drinks per week. Now, of course, a glass of beer is an 8-ounce bottle, alcohol, 1.5 ounces of liquor, and wine is usually a 5-ounce glass. Stress can often do crazy things to our bodies. I think it's important for everyone to take 20 to 30 minutes a day just to sort of de-stress, reevaluate your day, whether that means taking a nice hot bath, reading your favorite book, putting on some nice music, going for a power walk, and putting your music on your earbuds. Unhealthy lifestyle changes, such as excessive smoking, over drinking, or overeating, can also increase stress. Sleep apnea is a condition in which people experiences pauses in their breathing. Now, this has to be diagnosed at a clinic. If they once diagnose you and they feel that you need to wear an appliance or a CPAP machine, it's important that you do yearly follow-ups with your physician. We also suggest that you not take sleeping pills, excessive alcohol. Weight loss can improve your sleep apnea, along with the dental appliances or the machines. So remember the word fast. Face, arms, speech, and time is of the essence. Don't take a chance, call 911, because the quicker you act, the more the person you save. Thanks for stopping by, and I hope you enjoyed this video.